Hey you guys, it's Jessica. My username is Jessica Expanded, and today is Sunday, July 13th, 2014, and I am 23 months post-op Lapband surgery, and that's what my video channel is about. But the past year, I really haven't been doing many updates as far as my Lapband. Nothing has really changed all that much. I lost about 30 pounds the first year, and since then, I really haven't lost much. I had a little bit of a regain, and then I lost it. But yeah, so I lost about 30 pounds, and then I've been maintaining since then. My highest weight was 198 pounds, and today I weigh 167 pounds, and I'm 5'2". So my goal weight is probably like 130 or 135 or 125. I don't really know. Somewhere between 125 and 135, I think, since I'm so short. But this past year has just been crazy, and I feel like I'm constantly trying to lose weight, but it's more so like I'm trying to keep my head above water kind of thing. Like it's hard for me just to even maintain. So that's, what I've been trying to do. But I haven't done many updates. And my last update was really short, and I got cut off at the end. But yeah, as far as my personal life, everything is really great. I'm still with my boyfriend, almost 3 years now, and he's amazing. He's been with me from the beginning of my Lapband journey. And, work is fine. Work's work. And yeah, so everything's fine. I live in the city. I live in San Francisco, so it's awesome. And yeah, the only thing is the weight loss. And then I've also been having some health issues this past year. I've been in a lot of pain, kind of chronic pain, and some injuries. And yeah, nothing horrible, but it's hard. It's hard being in pain constantly. So that's another problem, and I think losing the weight would help with that. But I can't seem to either mentally or physically get below 160 or even 165. I've been sitting between 165 and 175 for the past year, so that's been hard. Anyway, the last time, I think the past 4 times I've come on here, I've been complaining about something. For a while there, my band was kind of being weird, and then I got that sorted out, found a new doctor closer to home, and then I think my band was too tight for a while, and then I got a fill, and then I got an unfill, and then I got fill again, and then I was having heartburn for a long time. And by the way, guys, if you guys have heartburn, make sure you go and get it checked out. I'll explain later. And then just recently, the past 2 months, probably since Easter, end of April, I was having the worst back pain. Like, I could not even walk. It was hard for me to teach my classes. I'm an exercise instructor. It was hard for me to see my patients. I see pediatric patients in the water, so I'm lifting and swimming and doing all this stuff. I was in a lot of pain. And I went and I got an x-ray. I saw a few different doctors. I saw a chiropractor. The doctor said I had something called spina bifida occulta, which is not like the stereotypical or the typical spina bifida that you hear about. It's a very, very mild form where the vertebrae, some or all of your vertebrae don't connect. I guess they're supposed to connect in between, and mine don't. But apparently I've had that my whole life, so I don't know why all of a sudden it would cause me this much pain. But they said that could be a cause of it. Otherwise, and I have like mild scoliosis, but otherwise they didn't see anything. So I had been doing some back exercises, core exercises. I mean, I'm a pretty active person and I have a pretty strong core. Everyone can improve on their core strength, but it was just weird to me that they're saying I need to do all these exercises and then that's what's going to make it better. It wasn't really getting better. So I had like this back pain for 2 months. And then 2 weeks ago, on June 29th, I think, I woke up. I was at my boyfriend's house, and I ate dinner. I had spaghetti squash and shrimp, or scallops, and after I ate dinner, I had the worst stomach pain, and it was weird because, as most of you people who are banded know, you can feel like you overate and your band is really tight and you have that like stuck feeling, but this wasn't that feeling. It was like right in the center of my stomach pain, like someone was stabbing me, and I felt full. And it was very weird because I've never felt this sensation since I had the band. With the band, I feel a different kind of full. I feel stuck full. I feel like it's going up. I'm like filling up to the top of my throat if I get full. This felt like how I used to feel on Thanksgiving dinner, kind of full, where your belly is just so full. And I haven't felt that way since I've had the band. It was very weird. And it was like my stomach was so bloated and like hard. And it was so weird. And so I was like, oh, I can't believe this. And I didn't even eat that much. It was very weird. I had 2 glasses of wine. So anyway, I went to sleep and I woke up and I had the most excruciating pain I've ever felt in my whole entire life. It felt like right in the center of my stomach, someone was stabbing me with a knife. And I went into the bathroom. It wasn't like a bathroom thing. I felt nauseous because of the pain, but I didn't feel like food poisoning, or it was something different. So I was laying on the bathroom floor and I called for my boyfriend and, like I could barely even move. It was so awful. So I said, we have to go to the hospital. And so we went to his car and I don't know the hospitals around there. He doesn't really know the hospitals around there because he's Kaiser and he would have gone to Kaiser, but he didn't know like with my insurance and stuff. And I don't even know how that works. So he was looking on his phone for which hospital to go to. And I couldn't even sit in the car. like, I got out of the car and I was laying upside down on his driveway. Like, my head was, like, going down the incline. And I was just laying there, like, just screaming with pain. So finally we called an ambulance to come get me. And, so awful. So then I'm, like, on the ground, puking on his driveway. And, and then the fire guy comes up to him and is like, "Oh, so I hear you're having some problems." And like I wasn't even there. Like, he thought Dan was having problems, even though I was on the floor puking. Very weird. He was unprofessional. And so I got in the ambulance, and I was very disappointed too, because first time in an ambulance, they didn't even put on the lights. I think I deserved the lights because I was in so much pain. And anyway, such a douchebag, the guy that took me, the firefighter guy. I thought he would have been cute too, and he wasn't. I got the duds. I did. I got, you think firemen are cute, paramedics are cute? I got like the least cute one. And so he took me to the hospital. What did I do? I was there in the ER for I was in the waiting room of the ER for 3 hours. Like, in so much pain, and like, there were really sketchy people in the waiting room with me, and I like didn't know what to do. Like, no pain pills at all for all that time, and it was like, oh god, I couldn't even sit in the wheelchair that I was in. And at first I was on a gurney, and they were like, "Well, we need this gurney, so you have to get in a wheelchair." And just like transferring me. Oh god, it was awful. So anyway, I finally got seen. I had a CAT scan done, and they couldn't give me any pain medicine, I think, because they didn't know what was wrong with me. So I was just in so much pain until they finally got the CAT scan back, and the doctor saw me, and then they finally gave me morphine at first. And the nurse was like, "How you feeling?" And I'm like, "Honestly, I feel exactly the same. I feel awful." And which is weird, because I thought morphine would make me feel better, but it didn't, because it was so bad. So they finally gave me some Dilaudid, and that it was like heaven sent. Like, oh my gosh, I needed it so bad. And the doctor said I had pancreatitis. So I guess that's where your pancreas is either infected or inflamed for whatever reason. And seriously, guys, like, I can't even explain it. So awful. And one of the nurses said, like, it's probably the one thing that they see the most where people are in like the most pain out of any other thing. So I could probably attest for that. So they finally admitted me to the hospital very early in the morning. So I was there for like 12 hours in the ER. And I think I got into the hospital around 6 in the morning, maybe 5 or 6. So I guess that's not 12 hours. I was there for 6 hours. And I was admitted to the hospital. They did some more CAT scans. They got me all set up. The hospital ended up being really nice, even though the ER scared me because I thought it was a ghetto hospital, but it wasn't. It was really nice once I got in. And they were basically trying to figure out why I had the pancreatitis, which is fine. Like, it's good to know why you have whatever you have, but the treatment's the same for all of it, pretty much. So they were asking me a lot about how much I drink, and because they said the main causes of pancreatitis are drinking, alcoholism, and gallstones, or gallbladder problems. And they did the CAT scan and my gallbladder looked fine. So basically they treated me like I was an alcoholic. And when I told them how much I drank, it was kind of like they didn't believe me all the way. And I was honest. I said I drink on average 3 times a week, 3 drinks per time, which is pretty accurate. And I said sometimes it's more and sometimes it's less. And when I say it's more, it would be like on a holiday I would drink a little bit more, or, something like that. So they took as sometimes it's more as all the time it's more. So they put me on alcohol withdrawal watch protocol. And I'm like, that's fine if that's what you feel like you need to do, but I felt very uncomfortable with it because the whole alcoholism or alcohol causes pancreatitis is more so as alcoholism causes pancreatitis, and I'm not an alcoholic. So that was weird to me, but they didn't know. I mean, they don't know me, so I guess that's what they felt like they had to do. And since my gallbladder looked fine, what else could it be? But turns out they did a sonogram and all these other tests. Since my liver looked fine, and everything, they took me off the alcohol withdrawal protocol, and kind of ruled that out. And then, so anyway, my mom made some calls to some people who work at UCSF, one of a very prestigious doctor that we know, and he was working with the doctors who were seeing me, and his theory is that I had gallstones, and I passed them while I was in the ER, and that's why they weren't showing up on the CAT scans, even though usually the gallbladder looks kind of sad and has some debris if you pass a gallstone. Sometimes it's not always the case, and he also said that the fact that I had really severe back pain for 2 months could indicate that it was that. But there's really no way of knowing, so I don't know. That's the theory that makes the most sense. Anyway, my Lapband surgeon was actually in the hospital when I went there, which was weird because I had switched doctors and I felt weird. And she came and she unfilled my band. They don't think that it had, this doesn't have anything to do with the band, but my band and my stomach were really inflamed because I was vomiting, and under so much stress, and everything was just inflamed. So she unfilled my band completely, and I was very lucky that she was there, and I was in Sacramento, which is weird, coincidence. So she unfilled my band, and so the first night I was in the hospital, They woke me up out of my drug-induced sleep at like 10:30 at night, and they took me downstairs to do a sonogram, and I was like, ugh, it was awful. I was in so much pain at that point. And so sonogram tech comes in, and he was very rude to me because I was like half sleeping, and every time he told me to like take a deep breath in, I would like end up falling asleep. And then he's like, you were supposed to hold your breath. And he was just so rude. And I was like, I'm in a lot of pain right now. I don't know what I'm doing. And I'm like on all these drugs. Anyway, so he did the sonogram. Then this other sonogram tech comes in and was doing it. And she's like, oh, what's around your stomach? What is this port? What is that? And I was like, I have the Lapband. And she had no idea what I was talking about. And I was like, I have the Lapband, bariatric surgery. You know, they put the band around your stomach. No idea. She just didn't even know. And I was like trying to explain to her. She was asking me all these stupid, dumb questions. And she was like, oh, how's that going for you? And I was like, it's fine, I guess. I don't really know. I lost like 30 pounds. And like, I didn't want to talk about my band. I was there for something completely different, and she just assumed that whatever problem I was having was because of the band. And so she's like doing it, and she's like, oh, how much weight did you lose? And I said, oh, I've lost 30 pounds, 35 pounds. And she's like, oh, so you weren't that big. And I was like, no, I was like almost 200 pounds. And she goes, you could have done that on your own. And I was like, excuse me, biatch? And I was like pissed. And I was like, okay. One, none of your frickin' business. And two, this isn't even why I'm here. And she's like, ugh. And then she was like shaking her head. And I was like, who are you? You're a sonogram tech. Like, that's a better job than I have. So no offense to any sonogram techs. But I'm like, you're not a doctor. You are here to do your job, look at my stomach, look at whatever's going on, and then give it to the doctor to diagnose. I'm not even here for this. And it was just so rude and like unbelievable. And I was already in a lot of pain, and I was like, I don't want to talk to you. Just like do this and let's get it over with. So anyway, the next day, my Lapband surgeon stopped by to see how I was doing again, which was very nice. And then I told her what had happened, and she was so angry. Oh my God. She was like so pissed. And so she's like, I'm going to take care of it. And like just the way she said it was like so funny, because I was like, oh man, someone's going to be in trouble. So I guess she made some calls, and the supervisor of the sonogram department like came up and talked to me and like asked me what happened, and it was like this big thing. Anyway, so that's that with the whole Lapband, how it ties in. So back to the pancreatitis. I was in the hospital, and I couldn't eat anything or drink anything, not that I wanted to, for 4 full days, because I guess your pancreas is what creates all the enzymes that help you digest the food, and I have an angry pancreas, so it's angry and does not want to give me the enzymes, or it produces too many enzymes when I eat or drink at that point. So I didn't eat or drink for 4 days. I was feeling a lot better. I drank, then I started on liquids. They gave me some clear Isopure and some broth and Jello, which did not sit well with me. The only thing I could really drink was the broth, and I tried to drink the Isopure just because my brain is like protein obsessed right now. So I was trying to drink that, but it just wasn't sitting well. And I think anything sweet that I was eating or like tasted sweet, it just, ugh, gross. So, yeah, I was drinking broth for a few days. They did more tests, and, basically it was just like they didn't really know. Then I had a gastro doctor come and see me, and he did a scope, a procedure where they put me on like twilight drugs. So I didn't remember any of it, but they did a scope down my throat into my stomach to see if that had anything to do with it, my like gastroness, and they wanted to see my stomach and how that was going. So they came back and they said nothing, they didn't see anything that would have caused the pancreatitis, but they did say that I have gastritis, which is heartburn, what causes heartburn and inflammation, and that I need to get that looked at. And then later on, they said that I have to go to the doctor again to get it fully diagnosed, but I may have something called Barrett's esophagus, which is a complication of heartburn where it's kind of like how your stomach ulcers, it's your esophagus ulcering. So the lining of my esophagus is being eaten away at, and which probably is why my heartburn, well, the heartburn caused it, but I was having pretty bad heartburn for a while now, and I kind of was just dealing with it. Should have gone to the doctor, but I didn't. So, anyway, I was finally able to eat some food and get off the Dilaudid because I kept trying to take morphine and it didn't do anything for the pain. So I was on the Dilaudid the whole time, and then I finally started taking oral Vicodin hydrocodone, and got off the Dilaudid so that I could go home. So I was in the hospital for a week, exactly 7 days, and then I was on bed rest for 7 days, so it's been 7 more days. It's been 2 weeks, and now I don't know how I feel. I'm so confused. I finally came home. I was staying with my boyfriend. I slept all day. I was on pain pills all day. I came home yesterday, and I feel okay, but not great. I don't feel like I'm better. Like my stomach hurts, and I don't have any appetite. When I eat, I only eat really small amounts. And, so that's it. And I just feel tired. It could be from the pain pills. Like, I don't take them as often as I was, but, I take them at night, or when I take them when I feel pain. So maybe like twice a day I'll take them. And, I'm on a low-fat diet, so I'm eating a lot of carbs, but I'm eating so little, I don't think it really matters. And they have me on a low-fat, low-protein diet, which is weird, because I'm so obsessed with getting enough protein, but I think right now I just have to focus on getting my pancreas better. So I'm trying to eat really healthy, lots of vegetables and lots of fruit. And I eat like broth, and then I'll have a little bit of protein at night, but not very much. So I guess from what I read, my low-fat diet will go on for a while. I'm not going to even think about getting a fill anytime soon. If I don't have an appetite anyway, it's not a big deal. But yeah, so I think I've lost about 5 pounds the past 2 weeks just from not eating very much. I try to get all my vitamins and everything from all the vegetables and fruit I'm eating. So, yeah. Sorry this video is so long. It's almost 30 minutes. But I wanted to give you guys all the details so that you might know, or if you suspect anything, that you go get it checked out. Anyway, so I'm going to go hopefully have all my follow-up appointments this week. I also am going to see my endocrinologist this week. He's really hard to get in to see, and I had a standing appointment. So I'm going to see him, even though I don't know what I'm going to do with that information right now, because I'm mainly just focused on getting better with all of this. So I am on disability right now. Hopefully I can go back to work soon, but I'm not really sure. I don't know. Like, I can function. I can go for a walk. I can cook my food. Like, I'm not like disabled. Like, I went out to dinner tonight with my family and I didn't eat very much, but I had a good time. Like, I wasn't like in excruciating pain, but there's pain there, and I just don't know about like teaching water aerobics, and I don't know about seeing kids who kick me in the stomach, or like all these things. Like, I don't see how I could go back to work right now with the way things are going. So we'll see about that. And hopefully I can just stay afloat with my finances and everything. I'm so worried about that. So anyway, that's that. It's 30 minutes. So sorry this was long. If you have any questions at all, feel free to ask me. And I will talk to you guys later. Okay, bye.